for this virus. 9 on your side's Rogelio Mars reports more tests could be available soon. He joins us with more now. Rogelio?
Pat, the Center for Disease Control has been the sole source for coronavirus tests to health providers. But today, we visited a private lab that says more tests will be available, and they say they've already started the testing process.
We have more tests than we had in the previous weeks, and that capacity is growing over time.
Dr. William Lanehart studies infectious diseases at Senora Quest Labs. He says they've had coronavirus tests ready to go since just yesterday. They say it's in the process of being approved by the Food and Drug Administration.
Part of that process is once you begin testing, you submit that test to the FDA for their review.
So where can you get tested? Definitely not at the labs. Doctors urged KGUN 9 to tell viewers not to line up outside their building. The tests used by Senora Quest are available to their clients.
Or Banner affiliated client.
The test itself involves this pack of materials. Doctors tell us this very pack could be used for a test soon.
It is placed through the nasal cavity and touches your nasal pharynx, which is near the back of your throat. And that's where the virus is replicating. The turnaround time for this testing is 3 to 5 days.
The director for the Pima County Health Department, Dr. Bob England, says the turnaround time could go up with more demand for tests.
The testing has been in such short supply that we don't really know the full spectrum of disease.
Dr. England says that's kept health officials from knowing just how many people might actually have the virus.
I'd like a much better idea of how much mild illness there is out there. The more you test, the more of that you're going to find, and the lower the actual death rate is going to be from this thing.
You don't want to rush to get tested just yet. If you have symptoms, Dr. Lanehart says the process should involve your doctor determining whether you're at risk first. Dr. England says if you wouldn't have gone to the hospital before, you probably don't need to now. Pat?